State fighting COVID on all fronts with support from the Biden administration.
Starting this week, the federal government will set up emergency testing sites in areas that need additional testing capacity. Before Christmas, the first several of these federal testing sites will be up and running in New York City, with many more to come. This free testing is going to help reduce the waiting lines.
Well, expanded test sites are just the beginning. The MTA also stepping in to provide free booster shots at 3 very busy train stations, starting this morning at the 42nd Street Times Square station and Jackson Heights Roosevelt station. And on Monday, booster shots will be available at Grand Central Terminal. Joining us this morning to highlight some of the other steps the state is taking to keep us safe is Lieutenant Governor Brian Benjamin. So, Lieutenant Governor, thanks for being here on an important morning. Good to see you.
Thank you so much for having me. It's a pleasure to be here.
So, Mr. Benjamin, let's get right to it, because President Biden has been in touch with Governor Kathy Hochul and your office really about addressing the COVID surge across the state. There's so many long lines. I'm sure you've seen the images, right? People are frustrated that they are waiting at this point in time in a line. How many and when will the emergency testing sites be opened in New York?
Sure. So first, we are opening up 7 more testing sites in New York State. And then, as you know, Mayor de Blasio has said that they'll be opening up about 23 to 24 more testing sites in New York City. We are creating a portal where people can go online and order a test so they can get it at home. The governor has ordered 10 million more tests as well. And as you know, the federal government is offering 500 million tests that will be given out around the country by early January. So we are aggressively tackling the issue. We're working with our hospitals. As we have been seeing, Omicron, while it has increased cases, has not exactly increased hospitalizations and deaths. And so what we are hoping is the case is that particularly those who are vaccinated and have their boosters, that Omicron is more like a common cold or the flu versus something much more severe, which would have more implications for our hospitals and would bring us back to a time we don't want to go to. So we feel very strongly that if people get vaccinated and boosted, and we provide tests that people know their status, they can sort of quarantine and we can be safe.
Now, let me ask you this, Lieutenant Governor. I have a 2-part question here. We knew that Omicron was spreading at just a ravenous rate around the country. We saw it happening in other nations before it even came here. It was doubling every couple of days. Did we get resources out quickly enough? Were we really in front of this? And also with what the president is committing to New York State, when can we expect these other measures to go into effect? The doctors, the nurses, the ambulances.
Sure. So we expect the 30 medical teams that the president has offered by early January. We expect the test, as I was mentioning, by early January, the latest. We are going to be opening up a new FEMA site in New York City before Christmas. And to your question around did we see this coming or should we have moved quicker, you know, as soon as we started to see Omicron occurring, we started moving aggressively. And, you know, Omicron obviously is much more contagious than any of the previous variants. And so, sort of coming to grips with that and making the right decisions is something that we have been focusing on very intensely. From the day we found out about Omicron, we have been focusing on what should we do here. The governor called on the president to invoke the Defense Production Act, which is going to have companies rapidly sort of create more COVID tests. And so we're doing the right things. And I think we're moving as aggressively as we can to solve the problem.
Yeah, I think a lot of people are looking at this saying, yes, you're moving aggressively now, right? But there's a problem happening right now. People are waiting in lines now. And the answer is go get tested, but we're only 3 days until Christmas, right? Are there options, Lieutenant Governor, of maybe turning the Javits Center into a mass test, mass vac site? Are you looking at those kinds of options right now on the table?
Yeah, all options are on the table. Obviously, they're being discussed very aggressively right now, so I can't speak ahead of those decisions. But we are working very aggressively on this, talking with the city and the federal government. That is why the governor has been speaking with the president so that we can aggressively address this issue in real time.
Where will that FEMA site, where is that going to be? Do you know?
I can't state that at this time. That is being sort of worked through, but know that you will find out shortly, and it will be operational before Christmas.
And also, when it comes to booster shots, we do a lot to incentivize people on the positive side, at least here in New York City, free, offering them $100, because we know that the efficacy of these vaccines, especially for those who got them at the front end, is wearing off. It's waning. What are you going to do to incentivize people, maybe even negatively, in order to get them to be compliant with this?
We are going on a very aggressive educational campaign to really talk about the risks that you are taking if you're unvaccinated. I think, one of the things that we now have to really focus on is how we're going to manage COVID, because it is clear COVID is going to be with us for a while. How do we manage it so that people are not being hospitalized and dying? And if you look at the numbers that we're seeing even right now, if you're the unvaccinated are making up 80 to 90% of the hospital stays. Northwell Health just came on and said that, quite frankly, the amount of people who are in the hospitals for COVID is half of what it was the end of last year's surge. But what you're seeing is that the lion's share of them are people who are unvaccinated. So what we have to do is make that case. I'm going to be going all across the state doing this on behalf of the governor, and we all have to make that case to folks. If you don't get vaccinated, you're putting your life at risk.
So could we
and
see,
the numbers are showing that out.
Yeah, obviously, yes, and that's a very strong point. Could we see then more mandates statewide, not only for private and public sectors, but also in schools?
The governor is we're gonna continue to make the most practical decisions that we can at the time. Everything is on the table, but I would submit to you a very important thing we have to do is talk to the hearts and souls of people who are not vaccinated and convince them to do so. Because, quite frankly, this needs to be a decision that people make to say, you know what, it's not about me, it's about saving my neighbor, my friend, my
But if they
loved
haven't
one.
done so yet, Lieutenant Governor, if they haven't done it
and I
yet,
think
are they
part
going
of that,
to?
and I think part of that is that we have to have different messengers. We have to work with communities that have been resistant. For example, as I'm sure you've recently seen, former President Trump made the case that he got boosted, which, quite frankly, a number of folks in his party have been discouraging people from getting boosted, discouraging people from getting vaccines, discouraging people from wearing masks.
Yeah.
So we have to fight that fight. That you can't mandate that through. I mean, we have a vax or mask mandate. A number of the counties have said they're not going to follow it because their populations are saying we don't want it. We have to go talk to them, and we have to engage them in a way that's serious.
But having
That
workplace
has to be part of the
mandates,
process.
is working, and perhaps
Correct.
educational mandates that could also begin to shrink that gap of people who are getting their children vaccinated as well. Is that on the table?
Listen, everything is on the table. I think it's clear that if you look at the 5 to 11-year-olds, the number of 5 to 11-year-olds who are vaccinated is much lower than it should be. We're actively thinking about how we try to aggressively ramp that, but we want to be responsible. We want to do it in a way where we're having a willingness of everyone to participate, and I think that's part of what we have to do. There's an educational persuasion campaign that is a part of this that I don't want to be underestimated.
Lieutenant Governor, I appreciate you being on here answering these questions this morning. A lot of people have a lot of questions ahead of the holiday. As soon as you know more information that you can share about those mass sites, just please let us know, okay?
We'll love to do so. Absolutely.
Thank you so much. Have a great holiday.
Thank you.